Hello, everybody. This is welcoming you to Ask Dr. Bob. That is me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer here at the American Diabetes Association, where answer your questions about diabetes. And as for those of you that are a frequent attender of this, we typically pick a theme and then focus on that. This month, we will talk about because it's Hispanic Heritage Month, we'll talk a little bit about diabetes in the Hispanic Latino community. And so that'll be our theme. For those of you that are new, please put any questions in the chat and we'll see if we can get to those as well. Feel free to follow me on Facebook, LinkedIn, and Twitter, where you'll see other posts of interesting things related to diabetes that may be a good source of information for you all. And if you like it, tell your friends and family to join us as we build this community. So let me get started. So the first question is, how common is diabetes amongst the Hispanic Latino population? Well, let me talk about type 2 diabetes in particular, and it is quite common. And so these are some staggering statistics. So for non-Hispanic whites, the rate is 8%. But it's literally double that for Hispanic Latino individuals, 17% of people. And if you look at the lifetime risk of developing diabetes, if you are of Hispanic or Latino heritage, it is 50%, meaning that half of the people will develop diabetes. And we'll talk about what we can do to stop that, but that is a very concerning problem. The other thing that's worth noting is sort of, as you can appreciate, Hispanic or Latino people really are a very diverse group, right? And they come from of heritage of a variety, Mexico, Puerto Rico, South and Central America, and other Spanish cultures, and so the risk of diabetes is not the same for all. So let me give you an example. If you were to compare those of Puerto Rican heritage to those of the South American heritage, Puerto Rican population twice as high a risk of diabetes as the South American heritage group. So there are differences within that whole group, and so that's important to keep in mind. So the next question is, what are the risk factors for diabetes in this community? And they're really in essence, the same risk factors as others for type 2 diabetes. Oh, before I do about that, let me just go back to type 1 diabetes. So people that are Latino or Hispanic heritage don't necessarily have an increased risk of type 1 diabetes. In fact, they might have a little bit less of a risk of type 1 diabetes. That said, they still can develop type 1. And so it's important to be thinking about both diseases to understand what, how to best manage. So what are the risk factors for developing diabetes? And this is really about type 2 diabetes. So one of the overwhelming ones is the presence of obesity. And so being overweight or obese increases the risk. A sedentary lifestyle, meaning not being physically active, also increases the risk of developing diabetes. Having a family history of diabetes is also increases your chance of having diabetes. If a woman had diabetes during pregnancy, gestational diabetes, that increases their risk of diabetes quite a lot after the pregnancy, twofold. So it really is pretty significant. And if you're a smoker, the chance of developing diabetes is much higher. And if you're interested in knowing what your risk factor is or what your risk is for developing diabetes or one of your friends or loved ones, the ADA has a risk test. The American Diabetes Association has a risk test that you can find online, and you can answer a series of questions and it'll tell you what your risk is. So those are the risk factors for developing diabetes. And the next question gets to complications. So what are the common diabetes related complications for Hispanic or Latino populations? And so here, it's really the same complications that everyone else, but there are a few of them that are much higher risk for this population. So, we know that diabetes is a leading cause of heart disease, stroke, blindness, and um, amputations. And the risk of amputations is higher in individuals that are Hispanic or Latino, and kidney disease is twice as more likely to happen in individuals of this heritage versus non-Hispanic whites. And so kidney disease is a really big problem and something that we'll talk about in a moment about what we can do about that. And then overall, this is really sort of stunning. Uh, the risk of death for Hispanic or Latino individuals with diabetes twofold higher, double the risk. So we really have something we need to do to prevent that, and we'll talk about that in a moment. So another question is how does ethnicity impact diabetes management and treatment in this group? And I think diabetes is challenging for everyone, and we know that. And then there are a couple of specific issues that may play out in the Hispanic Latino community. One is around communication. Well, if English is not your first language, that communication with your healthcare professional can be challenging. This is where you need to advocate for interpreters. And so please tell your friends and loved ones that are predominantly Spanish speaking that every healthcare facility should provide a translation system. And many times it can be, many health systems allow you to just dial a phone number and get an interpreter. So one is communication, and the other is some of the culture and cultural beliefs that can, get in the way of diabetes. So, the traditional foods are, depending on what country and what heritage one is of, may not be the healthy foods for people living with diabetes. So that's something to think about. And also something that if you're thinking about how to change your eating habits, meeting with a dietitian who can tailor the suggestions to the kind of foods that you're likely to want to eat. So they tailor it to your culture. So that's important. And then physical activity. There may be less of a tradition of going to the gym and doing those kinds of things. One of the things I found with my patients that can be a great way to engage in exercise can be dance, because for a lot of cultures, dancing is a very common and enjoyable sort of group activity, and dancing can be great exercise. I'll tell you, when I'm on the dance floor, I get tuckered out after a while, so it's good exercise. Um, and then there are, some cultural beliefs that some people may have, and some of that might be depending on who you are, that you tend to be more focused on the needs of your family, and you give your own health sort of, is down on the list of things that are important, and it's important that you take care of your health so that you could take care of your family. Uh, there may be more a tendency to think about natural or traditional medications as a treatment for diabetes, and less likely to use the more standard diabetes medications. And, whereas some of those things could be helpful, it's important to also talk with your healthcare professional about the medicines that can help you live healthy. Um, and then, something we've encountered a fair amount is there's this false belief that being on insulin will make you more likely to develop the complications of diabetes, blindness, kidney failure, amputation. And that is not true. Insulin does not cause any of those things. And so that's important, if you know people that think that's true, to give them the facts. Okay, so we've talked about risk factors, some of the special challenges, the risks of developing diabetes. Uh, And so are there some other specific barriers or challenges for Hispanic and Latino populations accessing care? Well, you know, one important one is that we know, sadly, the risk of living in poverty is higher, and we know that poverty increases the risk of complications, the risk of death, the risk of developing diabetes, and so that clearly is an important issue, and access and affordability of treatment becomes a big problem, and that's where the American Diabetes Association has really been fighting to ensure that people have access to the medical therapies that can benefit them, and also to the technology that can benefit them. The other thing is something that in the medical world, you may have heard this term, the social determinants of health. So we think about the medical determinants of health, and those are the risk factors I described, things like that. But the social determinants, turns out that there are a lot of social factors that can determine your health. And you wonder what those are. Well, you can imagine access to healthy food, access to safe places to exercise. Um, these are things that can impact your health, access to affordable housing, all of those things. So, one of the things I want to let you know about is if you go to the American Diabetes Association website, diabetes.org, and you go down to the bottom, there are community resources. And what you can do is put in your zip code where you live, and it will tell you the community resources that can help you on a number of those issues. Okay, we're moving right along here. So, what are the strategies for preventing or managing diabetes? And I think this is the most important part, because I talked about a lot of things that um, you know uh, people can do poorly with their diabetes and are at greater risk for death and complications and all that. The good news is there's a lot that can be done to prevent that. And so let's talk about that. First of all, what can you do to prevent developing diabetes? Well, first is to know if you're at risk, and that taking that risk test on the American Diabetes Association website takes less than a minute, and you'll know where your risk is. If you're at high risk, there's something called the Diabetes Prevention Program, DPP, Diabetes Prevention Program, that is available around the country. It's covered by Medicare. Other insurances are covering it, and we're fighting for more. Uh, that program lowers the risk of developing diabetes by 60%. It really is effective. So that's one great way to prevent developing diabetes. Being physically active, and that's sort of walking 5 days a week, 30 minutes a day, just that can lower your risk of diabetes. Now, what about for people with diabetes? How can we prevent the complications of diabetes? This is true whether you have type 2 diabetes, which largely is what we've talked about, but also true for type 1. What can you do to prevent diabetes complications? And I will say it is the ABCs, and some of you have heard this already. A, which is A1C. A1C is the measure of blood glucose levels, of your blood sugar levels over the last 3 months. Keeping that number in range. Know what your A1C number is, and get it, talking to your healthcare professional about how you can get that in the healthy range. So that's ABC. A is A1C. B is blood pressure. Maintaining a good blood pressure, a healthy blood pressure. What is that blood pressure for people with diabetes? It's less than 130 over 80. So that's pretty low. 130 over 80, but we know if you keep your blood pressure below that, and most people with diabetes are going to need medication to get there, you can lower your risk of heart disease, stroke, kidney disease, all of those complications. So ABC, A1C, blood pressure. The C is cholesterol, having a healthy cholesterol. And often, again, people need medication to get to that healthy range. Okay, so let's see if we have other questions here that are coming in. Um, I don't see anything right off, so let me. Oh, wait a second, I do see something. Uh, yes. So there's a great question about something called Project Dolce and peer support. And I actually was recently talking to the person that developed that program. So this idea, and this seems to be particularly effective in the Latino Hispanic community. Uh, you all probably recognize that sometimes we listen more to our neighbors and our friends than we do to our healthcare professional. And that peer support can be really important. So there are programs out there that connect you with peers, with other people living with diabetes like you. And when those are done well, they can be very effective. So thank you for bringing up that as an important way to help people with diabetes. So finally, we always like to finish up with, we covered a lot of ground. We talked about the risk factors for developing diabetes, the special considerations around language and culture that are important to think about, how to prevent complications and what complications individuals are at greater risk of, and and how to really prevent all of those complications. And of course, we can't cover everything. So where can you find out more? And really the best is to go to the American Diabetes Association website, diabetes.org. That's diabetes.org. And please spread the word to your friends and family about this program. Each month we do something else. I appreciate you joining. Follow me on Facebook, LinkedIn, or Twitter for more information. And please take care of yourself, be healthy. And on behalf of the American Diabetes Association and Dr. Bob Gabbay, take care until next month.